All right, medications that can increase your risk for blood clots like DVTs and PEs. So first, we have estrogen-containing medications, so things like hormonal contraceptives. It's important to note that the synthetic estrogen, ethinyl estradiol that's in a lot of birth controls is much more potent than, say, estradiol, which is what we use for hormonal replacement therapy and then for also transfeminine therapy. Estrogen is known to increase clotting factors. So contraindications with combined hormonal contraceptives, basically like estrogen-containing birth controls like Sprintec. We have history or acute breast cancer or any estrogen responsive like neoplasia or like abnormal uncontrolled cell growth. We have uncontrolled hypertension, which is a systolic blood pressure greater than 160 or a diastolic blood pressure greater than 100. Patients who are above the age of 35 who smoke, migraines with aura, severe liver problems like cirrhosis, and then also less than 21 days postpartum. After you give birth, your blood clot risk is extremely high. So I will mention that the risk of blood clots in pregnancy alone is a lot higher than the risk of blood clots when you're on a birth control. And then I'll also mention SLE with positive antiphospholipid syndrome. Some alternatives to combined hormonal contraceptives without estrogens are your progestin-only options, like norethindrone, which is an oral option. The missed dose window is 3 hours, so that's important. And then another option is SLIN or drospirenone. The missed dose window is 24 hours with that. Another progestin-only option is the Depo-Provera, which comes as sub-Q or IM. It's medroxyprogesterone. It's given every 3 months. For the IM version, you can give it up to 2 weeks early or 3 weeks late. Another option is the Nexplanon implant or etonorgestrel. It's implanted in the arm and it's removed after 3 years. And then another option after that is an IUD. So the hormonal IUDs use the progestin levonorgestrel, which is the same progestin that's in Plan B, which is kind of interesting. So depending on the brand and how much of it is in it, it can either last 3 years or up to 8 years. I'll lastly mention another option, which is the copper IUD or Paragard. It lasts up to 10 years, but it can cause a lot of heavy bleeding and dysmenorrhea. So dysmenorrhea being painful menstruation. Another drug class that increases the risk for DVTs and PEs are erythropoietin-stimulating agents, ESAs. So erythropoietin is a hormone that the kidneys secrete that stimulate red blood cell production. Some examples of this is epoetin alpha, which is Procrit, or darbepoetin alpha, which is Aranesp. So these medications we use with anemia related to CKD or chronic kidney disease as like a second or third line therapy after oral or IV iron. We only use this when hemoglobin drops below 10. The goal of this is not to normalize hemoglobin, but to decrease the need for blood transfusions and increase quality of life. ESAs are sometimes used for cancer patients on chemotherapy who do have anemia. It's important to rule out bleeding or anemia due to B12 or folate deficiency. And then same thing here, it's in order to decrease the need for blood transfusions and then increase the quality of life. It's not used for curative cancers as well.